Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Michigan lawmakers are responding to rural hospitals' call to action, questioning the classification of rural areas. Across the United States, what counts as rural community will play a significant role in how funding from the Rural Health Transformation Fund will be distributed and how much hospitals will have the opportunity to receive. Since funding designation for the state of Michigan was announced, healthcare leaders have expressed concern over the lack of clear guidance in distribution of the bureaucracy around applying for these available funds. Some Michigan legislators are reflecting that the original application for funding was not adequate to meet the needs of the state's rural health and places the state in a poor position to sustain healthcare in more remote communities. As a rural hospital, we appreciate these legislators' concern over rural health funding and encourage other states to work with their representatives to find applicable solutions to rural health sustainability. On to the damage report. A recent report from Covista shows the damage staffing shortages have on patient care, especially in rural areas. 8.4 million healthcare jobs are open nationwide every year. That's according to the report, and most hospitals say these shortages make taking care of patients' needs significantly more difficult. The roles that experience the most shortages are physician specialties, primary care physicians, and even technician roles. Rural communities report a more severe impact than even urban communities, with 85% of rural healthcare leaders reporting local talent shortages as a primary difficulty within their organization, nearly double the rate of non-rural areas. Based on national data, 2.3 monthly vacancies exist per unemployed worker in rural areas. That's versus 1.7 monthly vacancies in metro areas. Unfortunately, hospitals project this problem will only worsen in the future, largely due to the lack of new talent joining the pipeline. We highlight this report to emphasize the importance of fostering the next generation of healthcare workers, from high school nursing applications to student programs to long-term talent retention strategies. And now for today's success story. Many rural communities across our country lack access to youth mental health services. In response to this issue, the Virginia Healthcare Foundation launched a grant program called Nurture Now, which integrates mental health service providers with rural Virginia school districts. In total, the foundation distributed $1.2 million to help schools cover salaries for mental health professionals. Thanks to strong partnerships between community service boards, school systems, and other local providers, 1,200 students received mental health services at their schools within the first year that Nurture Now was implemented. We love sharing success stories like this because it shows how much community agencies can solve by coming together to address local healthcare concerns as a team. Thank you to our sources for this episode: Covista, Becker's Hospital Review, and Cardinal News.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.